Hey, I'm Di McQueen, licensed clinical social worker, family and addiction expert. I'm here with Dr. Brian Jackson, my longtime cohort who specializes in the field of addiction. Welcome to Healing Families Shattered by Addiction.
Di and I have worked with addicts, alcoholics, and their families for over 30 years combined. Our podcast and coaching programs focus on families who have a loved one suffering from addiction. Our experience has been that this disease affects families as much, if not more, than the addict or alcoholic.
Is your world spinning out of control? Are you codependent? Are you experiencing worry, loss of sleep, and difficulty concentrating? If so, you're in the right place. Brian and I have both personally lived it, learned it, and now we're going to teach you tools and techniques on how to get your life back that you thought was shattered by addiction.
Okay, let's dive in.
Brian and I are so excited to introduce to you our new sponsor, Lakeview Health. They are a wonderful residential treatment center. Whether it's the family member who is looking for a place or the addict or alcoholic themselves, this would be the place that we would refer them to. Brian, you have many years of experience with Lakeview.
Yeah, Lakeview Health is a center of excellent addiction treatment. They take an evidence-based approach, medical approach to treating this complex brain disease. They hold the Joint Commission's Golden Seal, and they were voted one of America's best treatment centers by Newsweek magazine. They deliver dual diagnosis, gender-responsive, and trauma-informed care at their gorgeous facility here in Jacksonville, Florida. But they do see people from all over the world do come here to Jacksonville to go to treatment at Lakeview. Their levels of care include medically supervised detox, which a lot of people do need. Then they stabilize them in a residential rehabilitation and partial hospitalization program. They have board-certified physicians, master-level therapists, and they work to address the unique needs of each patient. So in other words, it's not a cookie-cutter program. They help individuals build skills for long-term sobriety. So if you or someone you know needs treatment, please visit their site at lakeviewhealth.com. We also have a hyperlink on our website at familyandaddictionexperts.com where you can just click and get some information about Lakeview Health. And Di, I think you have a number for people to call if they would like to inquire about treatment.
I sure do. That number is 888-480-3799. That's 888-480-3799. Give them a call.
Hi, everybody. This is Dr. Brian Jackson, and I am here today at Healing Families Shattered by Addiction, and I'm very excited to have one of my personal friends, but also the outreach person for Lakeview Health. And Katie, I don't know if that's your title. I apologize. What is your title?
It is Senior Client Services Representative.
All right. Well, I apologize then because I just know you as Here Comes Katie, and let's get on. But for those of you that don't know, Lakeview Health is the sponsor of our podcast. We're family and addiction experts, and that is not limited to just coaching and counseling family members to the exclusion of the person that is in active addiction. So I want to make it clear that it is our goal to make sure that the entire family gets what they need to kind of be restored to sanity, if you will, in a normal life. So Lakeview Health has been a go-to for us for a long time. A lot of you know that I am in recovery. I went to Betty Ford in February of 2000 to date me. But if I was faced with that choice today of Betty Ford or Lakeview Health, I would choose Lakeview Health because of what I've seen there. And what I've seen is that it's not a cookie cutter template program. It is very geared towards the individual patient, and the family gets to get involved as well. But the staff over there, we've got everything, Lakeview has everything from psychiatrists to doctors, master's level clinicians. And as far as the administrative side, from top to bottom and bottom to top, there's a great understanding of the clinical side that needs to be addressed, and the patient always comes first. So, Katie, I am so happy that you're here to tell everybody about Lakeview and what services are there. The men's facility, the Star, the Rose, Stepping Stones. So welcome and thank you. And you can begin wherever you want to begin.
Thank you. Well, that's a lot. Like, how much time do we have?
As much as you want.
All right. Thank you. Well, I want to be sure that I communicate the important things about Lakeview Health and Stepping Stone Center for Recovery so that it will help families when they're ready to make a decision about where to put their loved one for treatment. Because eventually that's what your goal is when you're working with the families, is to help them move past being stuck and what do we do now? So Lakeview Health has been around since 2001, and I've worked here for 9.5 years. So I've been here a long time. And Lakeview Health, about 6 years ago, decided to split our Lakeview program into two to be gender specific. So the Rose is a program that is completely designed for women, and the Star is the men's program. So they're all very intentional about the way treatment is done, the way they're laid out in terms of the physical building and everything. So, and I'll start with those two. And we are licensed as an addiction treatment and recovery program. We also treat dual diagnosis. So that means we approach treating alcohol and drug addiction as well as trauma, mood disorders, depression, anxiety, and all the other co-occurring conditions. So that on the front end, when a patient's admitted, we're doing assessments from the medical perspective, the clinical perspective, doing a psychosocial, we call it, assessments. So we're screening for those things to see like what's underlying, what mood disorders are underlying the addiction, the using patterns of our patients. And one of the other things we assess for is pain from the medical perspective, because we have a pain recovery track here. And like you said, our physicians they're all board certified. They work for us. They don't have a private practice and just give us some of their time. They work for us. So our chief medical officer, and those who are listening, you want to go to our website and check out who our chief medical officer is. It's Dr. Lanty Jorenby. She did her undergraduate work in neuroscience at Vanderbilt, and then she completed medical school at the University of Florida's addiction psychiatry program, and she's board certified as a neuropsychiatrist. There aren't very many in the country. So she's pretty phenomenal, kind of running the show here from a medical perspective. And we're accredited with Joint Commission. We've been, by Newsweek magazine, designated as one of the best treatment centers in the country, which is really nice. So let's see.
Well, one of the things, Katie, that I wanted to ask you about, because the dual diagnosis is just so important. I think family members a lot of time just focus on the drug of choice that people are using, and the drinking could be a symptom of something else. And so the underlying reasons, by doing that biopsychosocial evaluation, you might be able to identify anxiety, depression, trauma, and the beauty, I think, of having psychiatrists and qualified physicians at Lakeview. Those issues can be addressed, and there might need to be some medication-assisted treatment put in place to help the person once they get into to sobriety and abstinence, and now those conditions can be treated, which may have triggered relief by using their drug of choice.
Correct. That's correct. And sometimes it's hard to tell which came first, the chicken or the egg kind of theory. Like, did the anxiety and the depression begin, and the using whatever substance is used to cover that up, or were some of those things created? But whatever the reason, we do assess for those and we do treat them. So if there is a medication that could help them with anxiety and depression that is not an addictive med, that's what we would use. Like we will not prescribe things like benzodiazepines. For those of you who don't know what that classification of drugs is things like Xanax and what's the other really pop, Valium and things like that. We're going to use non-addictive medications, and also those issues can also be addressed in our wellness center, where they're going to get regular exercise every day, and that helps a lot with decreasing the anxiety. And they're going to learn how to put activities into their lives without reaching for a drink or a pill. So really comes sort of, it's a holistic approach. So we're trying to address it medically, psychologically, psychiatrically, socially, all those things.
Can I jump in there, Katie? That there was one thing that you mentioned, the wellness center. And so a lot of people will pick a facility based on how beautiful it is without really doing any digging about, what kind of clinical services are they going to get while they're there. So I just wanted to brag on the facility, because when I go over there, it's just unbelievable. I think you guys spent over $20 million making the patient feel valued when they walk in, because it's such a beautiful facility, the workout facility, the swimming pool, just the location,
yoga studio,
and all that stuff. So I think that's very important, because, it's mind, body, and spirit. Yeah.
Right. And we do things. I was talking to a family member a couple of days ago, and her daughter was hospitalized, and she wanted her daughter to go to a treatment center that did equine therapy because she loves horses. And we have that. Like, we have equine therapy, surf therapy, excuse me, as well as the wellness center. There are other experiential sorts of activities that we try a little bit of everything to try to get at all. Like you said, it's not a cookie cutter, one size fits all. We're really looking at, what does this individual patient need? Is equine therapy something that might really help them address their trauma? Or surf therapy. If you can learn to stand up on a board in the ocean, and then we use that to say, look at how brave you were to even try that, so it really is like we're giving them experiences that are applicable in their real lives. So the wellness center is magnificent. Really, to have that on our campus is incredible. And the patients who go to the wellness center, that is also gender specific. So the women are there just with women. They're taken back to the rows, and then men, they have their own schedules. So I think the pool's getting ready to open, since you mentioned that. Now that we'll have a few more warm days, hopefully, and then it'll open up. And one of the important things that we do, and how we interface with you at Family and Addiction Experts, is that the family component is essential to what we do. So we have a licensed marriage and family therapist on staff full time. And that person meets with each family member, the family as a group, and then at a particular time during the patient's stay here, there's a family workshop that is a 2-day workshop for now, because it's still virtual. And the workshop itself is virtual. The patients are together in our conference center, and the family members Zoom in, and it's an all-day, 2-day workshop where the family members or loved ones might not be, might be a best friend of someone who is their key person that's going to help them in their recovery. They are learning the same things that the patients are learning while they're here. They're learning about, addiction is a disease, and it has to be treated that way, from a medical perspective. And they're learning about how drugs and alcohol hijack the brain. And they're learning what's their responsibility in the recovery piece and what's not their responsibility. Just like you guys are, you do that with the family members also. And so and we want to know what their history is with this patient, because many times, as you know, the patients minimize everything. They minimize all the bad things that have happened to them. I'm so sorry, excuse me. And so the family members really can give us a whole different perspective on what really is going on. So
yeah, and I think it's important with that education that you give the family. I mean, I think sometimes the perception is that the person is a bad person trying to become a good person, when in fact, you mentioned it is a disease. Right. So they are sick. So what you guys are doing and what we're trying to do, with the families, is get them to get well and stay well, because the ripple effect, family members get very, sick from this. But, to reassure families, sometimes, when they go to Lakeview, because you guys err on the side of caution, that sometimes detoxification is necessary, medically supervised, so that, we try to avoid, you guys do, any consequences as a result of the withdrawals before they're stabilized and get up and do all the wonderful things that you were talking about.
Right. And many of those things that I mentioned, they are not allowed to participate in until they complete detox, of course, because I look at detox as they're in ICU. They are in intensive care, detoxing from the alcohol or the pills or whatever it is they've been using, usually for years. And we want that process for them to be comfortable. We don't want people to be, sick and in pain as they're going through detox, but where they're being monitored, 24 hours a day while they're with us, and they're seen by providers every day. And, it's critical to the next step of treatment for them to be completely medically detoxed. And then their brains then can start to heal and be receptive to this new information they're going to gather. So it's a process. This is a really important piece of this for family members or loved ones. This is a process. And this is the first few steps that we take with them while they're here.
Right. And when they walk through the door, my understanding is you want to make them as comfortable as possible. I know you said detox was like ICU, and some people might say, oh my goodness, ICU, but it's not like that. It's a very comfortable room. And they're supervised. And so nothing to be afraid of, just making you as comfortable as possible.
Right.
From start to finish.
Yeah, ICU, I guess, is a scary word to people, but what I mean by that, I guess, is that we take it seriously, and want them to take it seriously. And it's not something you should do at home and not supervised by physicians or nurses. So we kind of wrap ourselves around them, the treatment team does, to make sure they understand they are in a safe place. And many times, one of the first things they say after 24 hours of being here is, I was so scared of the detox process and of treatment in general, but your staff has made me feel so safe here and accepted, and it's non-judgmental. And, a lot of people say once they're ready, they're really ready to go home, and they don't really want to leave because they feel so safe here. So it's, So that's,
And that's very reassuring to people, because I think sometimes the preconceived notion is, oh my goodness, I'm going to rehab. It's going to be like, jail and, all the rest, where, I think the goal of Lakeview, from what I've seen, is to detox, stabilize, get people up to where, they're up and running. They're getting good nutrition. You have wonderful food there. They're getting some exercise, but most importantly, they are getting sleep. Now that their drug of choice has been had time to get out of their system, because so many people suffer from disrupted sleep, especially with alcohol.
Right. That's exactly right. Yeah. So that process for us can take anywhere from, for detox, I guess, 5 to 7 or 10 days, just depending on the person. And then they transition into what we call residential level of care, like you just described. They move on with the educational process and their groups where they can process what are those things that brought them to treatment. where did this anxiety and depression come from? And trauma, they're all being assessed for trauma. And we have trauma groups in the men's program and the women's program. So they're learning about what trauma really is and how it's triggered and what the person can do to address it so that it becomes less and less of a problem for them. And they start to manage the old memories. And you know a lot about trauma. So I know you know how to treat it.
Yeah, it's interesting too, because we talk about trauma a lot. And I think people go to, being in combat or, God forbid, being raped or, something that's very, very traumatic and obvious. But there's a lot of underlying trauma that people don't recognize until they get into a program like Lakeview. They might be an adult child of alcoholics and, what that was like to grow up in that household. They might have unresolved grief that they've just kind of stuffed. And those are just a few examples. We could go on and on, but the counselors are really focused on discovering some traumas that maybe the patient didn't recognize that were underlying reasons, that were, memories that they were trying to bury either through alcohol and drugs or just try and bury it in their mind. So some of those things are open wounds if you don't heal them. But I think by talking and the therapy that you guys do there, it doesn't mean the trauma is going to go away, but it certainly can scar up. And that's what you guys do.
All of our staff across the board, including the dietary team and housekeeping and everyone, is trained in trauma-informed care so that all of our staff know, what it is and how to handle patients. Like not, for example, just something very simple, not walking up behind someone and tapping them on the shoulder or letting them know you're passing them in the hallway. That might startle them. Like things like that, our staff knows not to do that. And sometimes if someone is safer, and this is a very simple thing, but if they feel safer sleeping with the lights on in their room, the staff does not come along and turn the lights off. They really look at every individual person. And we, like I said earlier, we provide this trauma assessment. And in the trauma group, they learn grounding skills. And that was one of the things I was sort of referring to earlier about teaching them how to recognize when the symptoms of trauma are coming and what triggers it for them. They learn some grounding skills. And we also have a meditation room in each of the programs at the Rose and the Star, where we teach patients how to meditate and address trauma and anxiety. And they're free when they need to go to the meditation room and address something after a group or something. And it really, really helps them tremendously, because I would say 75 to 80 or higher % of our patients identify as having some sort of trauma. So it's something that's very important to us here. If we're going to teach someone how to stay clean and sober, we need to also address these other underlying issues.
Yeah. And, typically there's busy minds, and being able to learn how to do meditation, how to be able to slow down your mind, how to organize your thoughts, how to not react, but rather to respond in an adult rational way, that side of our brain, as opposed to the impulse side of the brain. So, the staff over there is just so in tune with so many different things that I think that a lot of patients and families, it's outside of their awareness, and they just focus on stopping the drinking or stopping the drugging. But if you don't make these other changes, it's a little bit more difficult to maintain sobriety. But if you have a good understanding and a balanced assessment of yourself, then you can address those things and basically, hopefully, be comfortable in your own skin.
That's right.
So,
correct.
So yes. So anything else, Katie, that you want to talk about in terms of you? And
I would say that, one other thing I haven't mentioned is that, since I did say we consider ourselves to be, we provide the first few steps for these patients to become clean and sober, and then start to address their issues, start to implement new strategies in their lives, whether it's working out, running, or doing meditation to learn how to calm their minds, or yoga, or whatever it is. And when they leave here, the hardest work begins. So we introduce them to our alumni team, our alumni coordinators on staff, one for the men, one for the women. And I haven't talked about Stepping Stone yet, but I will. I do need to address that. So the alumni team has monthly activities for the patients once they leave, and we do them in different parts of the country. So there's one in the Northeast, there's one here, there's one in South Florida, I think there's one out in Arizona. So in addition to that, they meet with the patients here on a weekly basis to talk about what is your plan going to be when you leave here? How are you going to continue to address, and how important it is to stay connected to the people you were in treatment with, and also people who've been out there living their sober lives and are good examples, they're role models to them. So that's a really important piece of our program is
absolutely. Because, for 30 days, all your choices basically are taken away from you in terms of drinking or taking drugs.
Right.
And so you do really well. And after 30 days, 45 days, 90 days, whatever it is, when you get out, that's where we used was in the real world. And what Lakeview will do is write a discharge plan that's individualized to whoever it is. So the continuum of care is stressed, because now you get out, and it's real important that you follow through with what your primary counselor is suggesting, or the team of counselors is suggesting for you. And it will be very specific to your situation. It's not the same discharge plan for everybody.
Right. It's definitely not a cookie cutter plan, as you said. So the way our treatment team works is that the master's level and licensed therapists that we have are free to do therapy with their patients, because they have, they're not bogged down with, like some facilities are, with a lot of paperwork. We have case managers who handle whatever barrier there might be to treatment. Like if a patient needs to have their electric bill paid while they're here, they handle those things for them. If there's a legal issue, the case managers handle the communication with the attorney or judge or whatever. And then on the next level, there's an aftercare coordinator who helps plan along with the medical team, the clinical team, what that patient needs when they leave us. Maybe they need another level of trauma work called EMDR or something like that, which, or a trauma therapist. Or maybe they continue on with a psychiatrist who can monitor the medications that they're leaving with, things like that. And then the alumni team. So we really are trying to look at, like I said, the whole person, put together the plan that works best for that person. Sometimes it is to go on to an intensive outpatient program somewhere, either in the daytime or in the evening. And that way they continue on with another outpatient type of treatment, but to continue on with what they've started here, to look at continuing to address the family issues they might have, or whatever, the depression, whatever they've identified here as their triggers. So
right, that's real important as you talk about the continuum of care. A step down from an inpatient treatment facility to an intensive outpatient treatment facility or outpatient treatment facility, where you're really dealing with life on life terms. Maybe there were some triggers before. And now you can address those issues, on a continuum care at that level of treatment. So again, very, very important. But the first things first, we need to, get into the inpatient treatment facility and do all the wonderful things that you guys do to get people prepared for when they do leave, and how they're going to, maintain their sobriety out in the real world.
Right. Because they won't. for someone who meets the criteria for coming to a residential program, you can't just like walk in the door and say, I want to quit drinking when there haven't really been the signs and symptoms maybe that they need to. But everyone who walks in the door here has a history of abusive, drinking or using, and they don't have a choice any longer. Their brains have really been hijacked. So in order for them to, they're sort of practicing, they're learning here what they need to do, and they can go out, like you said, in the real world and really get a feel for what this is going to be like. How am I going to handle the stress of going back to work? And in a lower level of care, like an intensive outpatient program, like you said, you get to see the real life, like, how do I do this in real life? And you hear in the groups, like sometimes people say, I'm not comfortable talking in groups, but the value of doing this in a group setting is that there is someone else in that room who's been through exactly what you're going through, had probably had the same thoughts you're thinking right now. And that all helps your level of understanding of how does this work and what are strategies other people have used that I can now put into practice. And it's something that is a lifelong, commitment to keeping yourself healthy. And it never gets better. It always gets worse if you don't get help the help that you need, just like any other illness, like diabetes. Diabetes is not going to get better on its own. It has to be treated by medical professionals, and changes have to be made in someone's life. So this disease of addiction is the same way.
Right. And just so important that it is an illness, that you're not a bad person trying to become a good person. And I know you guys group over at Lakeview, and the point that you were trying, or that you made, was you realize that you're not alone. You're not terminally unique. That when you walk in a room and you hear other people's experience, strength, and hope in terms of their lives, there's something miraculous that happens. And people typically, maybe in the beginning are not willing to share, but as time goes by, they're kind of warm up to the whole process, and it typically will start to reveal things about themselves.
Right. And the same thing is true of their loved ones, of their family members, as you all see, and in our groups for the families, when they come to that family workshop, they realize, like, I am not alone. This is not just happening to me. It's sadly a common problem we all have in our country and our society these days. So I feel very fortunate that I've been able to work at Lakeview for 9 years and collaborate with people like you and Di at Family and Addiction Experts. It's very rewarding to know that we're doing something that helps people change the direction of their lives. So,
and so there is a solution. So it's not helpless for the family members in terms of the way they're feeling and ruminating about things and anxious, and it disrupts their lives. And a lot of times they don't know what to do. Intellectually, they know that something's not right, as does the alcoholic or addict. I mean, it's rare that intellectually they don't know that it's a problem. It's just taking that step and having overcoming that fear. And then, as you said, people get in there and it's like they can breathe. It's like, oh my goodness, this is not my preconceived notion. This, contempt without investigation as to what treatment is all about. So, but it's wonderful. I feel very blessed that we're both in this industry, because there's so much that reward that comes from seeing people heal and families heal.
Right. It's very rewarding. I mean, and sometimes, like, I do a lot of my work on the phone with family members who call me. Like, if you have someone that you're working with a family and they finally have their loved one ready to come to treatment, or at least to talk to me, I might never see that person when they get here. Sometimes I do. And I might see them like after they are here 2 or 3 days. And then if I see them 2 weeks later, because I've come here to bring somebody on a tour or something like that, and I see that same person and go, oh my gosh, like the physical changes that take place are amazing. Like once all the drugs and alcohol have left their bodies, their faces brighten and they, eyes are clear and they start to, take care of themselves and actually like brush their hair or whatever, those changes that it just is a miracle. Miracles really take place here every day.
Yeah, people neglect themselves too, and if they're drinking, they get dehydrated and, they're not sleeping well. They may be gaining weight as a result of all the sugar they're ingesting from the drinking. Yeah. And so after a period of time at Lakeview, I used to, when I ran an IOP, ask permission to take a picture when they came in and a picture when they left. And people would be so amazed, like you said, their complexion, their eyes, they've lost weight. They're not spending money on alcohol or drugs anymore. Yeah, that transformation in a very, very short period of time is radical. It really is.
It is a transformation. That's the best word to use for it. Yeah. So,
well, Katie, if somebody wanted to get a hold of you or of Lakeview, I know we've got a direct link on our website, but we can flip back around to that. Do you want to let people know how they can get a hold of Lakeview or get a hold of Katie or however you do?
Like to give my cell phone number is 904-422-0555. And if you call me and you don't get me, like I would not be answering my phone right now because I'm on this call with you. So if you leave me a message, that's great. But if you also need to talk to someone right that minute, you can call into our intake office. And this number, and since we're doing this on your website, people can have an opportunity, to write it down. The other number they can call to get me is 904-406-7426. So those are two numbers people can call to either get me or our intake team. And
the website, Katie, is?
LakeviewHealth.com. So www.lakeviewhealth.com. There is if you want to see who Lanty Jornby is, there's a link to her bio, a picture of her. There are also articles on our website that you can find on, which I know you and Di do, how to talk to your loved one about that they're using. There's some strategies and things not to say and things to say, all sorts of things like that, like not waiting until the person hits rock bottom, because sometimes people die when they are left to hit rock bottom. So there are all sorts of really educational, in a blog, I think, on our website. It's a lot of good information. You also can see the pictures of Lakeview, and I promise you, the program and the campus look like those pictures. Like they're not just bought somewhere and slapped on the website. Like this campus is really beautiful and a very safe place for your loved one. So,
and you also have the option, if you want to jump on our website, which is www.familyandaddictionexperts.com. And you will see Lakeview Health, I believe, right on the first page. And there is a link there. There is a phone number there. And again, like Katie said, they're very quick about getting back to you and talking to you. And, it's not going to be a long wait before you're able to connect with somebody. And if you have any questions for myself about Lakeview or about anything, you can write us an email at info@familyandaddictionexperts.com. I know we've hit you with a lot of .coms and phone numbers, but it's readily available on Lakeview Health's website, and it's readily available on Family and Addiction Experts website. So I hope and know that this has been helpful for those of you who are listening, wondering what the process is like for your loved one that's in active addiction, that has finally decided that maybe they need help. And again, I can't reiterate enough how comfortable I am after 23 years, in this field with Lakeview. Feel very, very comfortable that once I refer somebody there or Di refers somebody there, that they are in good hands. And they're very seamless in terms of if it's somebody that's working with us in getting us weekly updates as to how the person is doing, which is always comforting. But we have full faith and trust that the person is getting the very best treatment that they possibly can. So Katie, I can't thank you enough for coming on here with me. And it's always good to see you. And, look forward to seeing you again in person.
Thank you.
Maybe we can grab lunch or something like that.
All right. That sounds great. And thank you so much for the opportunity. I really appreciate it. So.
All right. Well, thank you so much. And everybody, we will see you in a couple of weeks. Not see you, but we will have another podcast. And this podcast will be posted on the website. I think there's about 9 of them. This might be number 10. So there's a lot of information on there. And, Katie had talked about the family. There is a family survival kit PDF form on our website that you can download and see if some of that applies to you. So in any event, thank you so much, Katie.
Thank you. Have a great day.
All right. Bye-bye.
Thanks so much for joining our podcast, Healing Families Shattered by Addiction. We'll be back in a couple of weeks with more important tools, techniques, and ways for you to focus on you instead of the alcoholic or addict in your world.
Until then, please go to our website, familyandaddictionexperts.com. That's familyandaddictionexperts.com. You'll also see links to our Facebook and Instagram pages. Please also, if you have any emails that you would like to send us, that's info@familyandaddictionexperts.com. That's info@familyandaddictionexperts.com. With any thoughts, feelings, questions that you may have for us, we would love to hear from you, and we look forward to seeing you in a couple of weeks.